I just can't believe that now I'm 63. At 41, I was supposed to be dead. And then I think it was 96, we got a letter from the federal government. I had proof I was still alive. I actually said, you have outlived your expiration date. You must prove that you were alive.
Now, besides outliving her expiration date, Kathy Jordan fought for her life using cannabis in a different way also.
She said, I don't feel good. Well, I took her to the doctors, and she had a cancerous tumor in her stomach.
Desperate to save her life for the second time, knowing about the possible healing capabilities of cannabis, Kathy took cannabis oil for a few weeks before her surgery.
When the doctor operated, she said she never saw a tumor do what that tumor did was it turned on itself and cut its own blood supply off. And the only thing I can give that credit to is that oil that she took.
You survived surgery, but I've never seen an ALS patient survive surgery. I mean, you have beat all the odds, and Dr. Will was just, like I said, he's been 35 minutes just pulling his hair like, oh my God, can I film you? Can I film you? I want to share it to my students. I said, yes. I said, I will even give you permission to say that the patient believes that cannabis is what keeps her alive.
I just wish they would study it and find out what's going on, because she's living proof that there is something. And anybody that knows anything about ALS, it is one of the most horrible things you can watch. We've met doctors, we met politicians, we met other patients. We've tried everything that we know how to try to get these people to open their eyes and study this plant. It's an amazing, amazing plant.
I have proven them all wrong. In fact, I really am outspoken, only because I realize my doctors are dying and retiring. I'm outliving them. I'm telling you, this has stopped my disease.
When you see this word, what images come to mind? What if I told you that you're only half right? What if I told you that this plant also had the capacity to heal millions of people suffering from life-threatening diseases? Would you believe me? Would you allow yourself to embrace this notion with open arms? Or would your preconceived ideas get the best of you? What if it could save the life of someone you love? What if it could save your life? Are you listening now?
Think the Caribbean is all fun in the sun? Well, think again. Join Wealth TV for an exciting episode of Behind the Name. We're showing you the rarely seen side of Sandals Resorts founder Gordon Butch Stewart. So how can all of these cases of marijuana healing medical conditions be explained from a scientific point of view? Well, perhaps, just maybe, we are wired for weed, so to speak, and there is a system in our body that combines to cannabis on a molecular level. To answer that question, along with many others, we're heading to Israel, a country who has been a pioneer in the cannabis research field. This is Dr. Meshulam, the world's leading expert in this field and the grandfather of the medical marijuana movement. It was over 50 years ago that he first isolated THC and CBD, the active and inactive components in marijuana. And today, it is his original work that has led to many groundbreaking advancements in the medical cannabis field.
When we started working exactly 50 years ago on cannabis, very little work was being done. People had looked into it, but didn't really know how THC works. At the beginning, we worked on the isolation, structure elucidation, and synthesis of both the active compound of many of the other compounds.
After years of working on this, Dr. Meshulam was able to successfully isolate the psychoactive component inside of cannabis called delta-9 tetrahydrocannabinol, along with many other chemical compounds of the plant, such as cannabidiol.
There are also other compounds there, and we had to devise methods for their preparation. So this took a few years.
Dozens of researchers around the world knew that THC indeed affected the user and made them feel high. But researchers didn't know how this process actually happened. It wasn't until 1988 that a U.S. researcher named Alan Howlett first suggested that there might be a receptor, something actually inside the brain, that THC binds to on a molecular level, and that causes a series of reactions to start. This idea of having a receptor inside the human body that is activated by THC was confirmed years later by a group at the National Institute of Health in the U.S. This first receptor was located inside the brain, and they called it CB1. Then, in 1993, CB2, the second cannabinoid receptor, was also characterized. Shortly after the discovery of CB1 and CB2, Dr. Meshulam identified anandamide, the body's very own produced form of THC.
In the early 90s, 1992 and later, we identified two compounds that are endogenous. They're present in the brain, they're present in the body, they activate the cannabinoid receptor. Actually, there are two receptors. They're of extreme importance. The first compound we identified, we called it anandamide.
Anandamide is a naturally produced molecular messenger molecule called an endocannabinoid. Anandamide has a three-dimensional structure that THC mimics. Think of them as organic cousins, if you will. Although one comes from the plant and the other is produced in our bodies, their effects on the brain are fundamentally the same.
Then later we discovered another compound, and these two compounds are the main compounds that stimulate the two receptors.
This they called 2-AG. The discovery of 2-AG was very important in that it established the existence of a cannabinoid system within the human body. So, to put it all together, the cannabinoid receptors called CB1 found in the brain, plus the CB2 receptor in the immune system, along with the endocannabinoids called anandamide and 2-AG, and all the other molecules involved, are a part of a relatively new body system that researchers are calling the endocannabinoid system. Today, it's the discovery of the new endocannabinoid system that researchers are continuing to study. The belief is that this new system, similar to a
viruses, microbes, and so on, the immune system. Now, how come we don't have a protective method, a mechanism, a system against other things? And apparently, the CB2 receptor, activation of the CB2 receptor, is a mechanism, a protective mechanism, including possibly cancer, including possibly mental diseases, schizophrenia, and so on.
This raises the question, why would a plant, the only plant in nature with cannabinoids, activate that same set of receptors in our body? Join Wealth TV for a new show that's blowing the lid off the drug debate.
The 21-day treatment of CBD, and CBD alone kills the cancers and cuts off the blood supply to itself and dies.
Drug prohibition as a policy is the biggest failed policy in the history of the United States of America, second only to slavery.
Find out what they don't want you to know about this potent plant.
You can smell this. This actually smells very good.
Oh, that smells beautiful.
It's all a touch because he has to feel how much is necessary, if the load is good enough, if it's well distributed.
On the average, we are making much better cigars than any Cuba can make. Salud.
Salud.
If these walls could talk, you would listen. If you think stories about rich housewives are interesting, then you obviously haven't studied history. Before there was reality TV, there was real drama. Learn the history that inspired fairy tales and legends. Uncovered tales of murder and deceit. Relive stories of forgotten times on Tales of Castles and Kings.
By researching and working with cannabinoids such as THC and CBD found in the cannabis plant, researchers are able to gain a better understanding of how the receptors work and what role chemical compounds of cannabis play in helping and protecting our body. Dr. Meshulam explains that one such important study was that of Dr. Manuel Guzman in Madrid, Spain.
He works on the mechanisms of cannabinoids in cancer. He does extremely important work. He also did a clinical trial in Spain against glioma. Glioma is a terrible disease. It's a brain cancer. He found that administration of THC to patients can prolong their life.
The major lines of research of our group are devoted to cannabinoids and cancer, cannabinoids and neurodegeneration, and cannabinoids and brain development. With regard to cancer, we are trying to envisage whether cannabinoids could be anti-tumor compounds to be given to patients with cancer.
And although THC is being used in the various studies and seeing success in test trials, there is still concern about the psychoactivity of it due to its activation of the CB1 receptor. Well, one interesting fact is that cannabidiol, or CBD as it's known, another cannabinoid found in the plant, acts as an antagonist to THC and actually reduces the psychoactive properties. So for example, in the future, if THC or a THC-derived medicine is used to treat a disease such as cancer, CBD could in theory be used additionally to reduce the psychoactive effects of THC without taking away from the medical benefit.
Cannabidiol, as I said, is a non-psychoactive material, but surprisingly, it has all kinds of mainly positive things. It can lower some of the undesirable effects of THC. Cannabidiol prevents this.
On that same note, a whole range of scientific research is also being done on the effects of just CBD and the positive results it's having on the endocannabinoid system.
Cannabidiol, in addition, has its own effects. It is anti-inflammatory. We published a paper in the Proceedings of the National Academy of Sciences that it is a very potent agent in reducing the effects of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. An autoimmune disease is a disease in which the body has some things mixed up, and it attacks its own system. And there are quite a lot of autoimmune diseases. Another autoimmune disease is diabetes type 1. So we went ahead and looked whether cannabidiol is good against diabetes type 1. And we found in mice that it is very good against diabetes type 1.
Another area where CBD is seeing positive effects is in schizophrenia patients in South America.
This is important because schizophrenia patients can be treated with drugs, available drugs, but these drugs always have side effects. Cannabidiol shows no side effects.